So the next one is it will be presented at poster session today by Dr. Chika Kato, one of my younger colleagues in my institute. So the study is just a single cell institute study, a retrospective one. So we basically collecting the samples from over 40 patients of AML, and they were treated by a venetoclax combined regimen. Most of them were combined with azacitidine, and some of them were RC, low-dose RC. And most of the patients could go into the stem cell transplant. And actually, if the patients achieved complete remission before transplant, the 1 year overall survival was over 80%. So it's a good data compared to the previous reports. While the non-CL patients at transplant, the long-term survival was around 20%. It's disastrous. So we conducted a comprehensive next gene genomic profiling analysis using the next generation sequence, and with a 70 genes panel. It's a kind of a genetic analysis. So we identified two very important genetic pathways. One is TP53 mutation, and another one is signal transduction pathways, including the KIT pathway and the FLT3 pathways. So if the patients has these kind of two either mutations, their long-term survival was significantly lower than the others. So we found that the azacitidine and venetoclax combination is very helpful for the patients with high-risk AML before transplant as a bridge to the transplant. But still, if the patient has TP53 mutation or signal transduction pathway mutation, last pathway or MAP pathways and FLT3 entity mutations, their prognosis is pretty bad. So I think this study should be evaluated in another cohort in the near future.